I'm really grateful for this opportunity to talk with you and also to learn about the illness that you are all facing. As Jason mentioned, I work with a number of patients facing a number of different chronic and life-limiting illnesses, but I will say I've learned a lot about spondylitis since being asked to present here. So the title of the presentation, Some Days Are Better Than Others, Riding the Waves of Chronic Illness, is really to speak to the idea of the fact that there are acute moments of illness, there are chronic times that you're dealing with this illness, and it's hard to predict what the waves are going to look like, just like the ocean. And it's not necessarily about getting knocked over by the waves, but learning how to find what your surfboard looks like and how to ride on them. So the idea that your life is dynamic is really important, particularly for all of us, but I think when facing a chronic illness, that becomes much more relevant. The things you might have depended upon in the past are no longer predictable to you. So thinking about the quality of your life and looking at the different pieces of that is very important. So thinking of your physical well-being, and that's often what people think about when they're talking about illness, but there's also your psychological health, your social well-being, and your spiritual health. And all those things comprise what we consider and define quality of life. Just as an overview of what I want to focus on today, I really hate standing right behind this thing. I'm sorry, I'm going to have to walk around like an entertainer. What I want to focus on today is what is stress. I think we also often give stress a negative connotation. And dealing with a chronic illness is very stressful, but there is something to learn about stress, which is how can you learn how you respond to stress, and how can you harness it for good in your life? And then talking about coping response. And again, coping is often a term people use positively. Stress is the negative, coping is the positive, but there are negative ways of coping and maladaptive ways of coping, and learning how you cope with stress, learning your own tendencies, your own autopilot when you're in crisis is really important for learning how to cope in an adaptive way that doesn't cause more harm to yourself, your family, or exacerbate your illness. And then we'll talk about some evidence-based coping and stress management techniques. Because when Elin called me, she said, people want to walk away with some tools. So I'm going to give you some tools, but I want you to know there's not a one-size-fits-all. And that's why I want you to think about as I talk, how do you respond to stress? What do you do when your body or your mind is under stress? And then you will maybe find some of the tools that I offer that are more relevant for you, and maybe the others that you say, that's not for me. And hopefully we'll have some time for questions at the end. So a little bit about semantics. We talk about chronic illness in terms of an incurable, lifelong experience, but that doesn't mean it has a chronic or flatline experience. It tends to have acute or episodes of times when it is more intense or more difficult to manage. And those tend to be, of course, the more stressful times. The idea of being diagnosed with a chronic illness is stressful, but I think it tends to be those acute times that they really upset the apple cart, and you have to figure out, how am I going to predict or try to respond to those so that I can continue to maintain some level of the quality of life that I want and that I value. So, as I said, stress. I love this word cloud. I wish we could spend 5 minutes dissecting all of the words in it. But stress is our body and our mind's response to something that puts demands on it that we don't know if we have the resources to manage. And it affects us physically and psychologically. I'm certain many of you have heard the fight or flight response, which is a human response in our sympathetic nervous system when we perceive threats. So I want to talk about how, again, stress is the physical, mental, emotional, and social tension that is a reaction to perceived threat. When a person believes that these demands exceed their personal or social resources, to mobilize in response to stress. Facing a chronic illness means often that you're losing a lot of things, and the main one is a sense of control. And that is very stressful for us. Our culture in the United States fancies itself very much able to control our destiny and our lives, and we really like to believe that we are in control. And that idea that an illness that you may not be able to cure is going to take over the control or cause a loss of either relationships or job or just your identity. Change your identity is very stressful for people. But I want to focus on the fact that stress is not always bad. And that's why I put these curves up here, these bell curves, because these are the stress curves or the human function curve. Show of hands if anybody's familiar with this theory. Okay, good. Hopefully I'm teaching some people a few things that they don't know. So stress is not all bad, as I said. We in this culture love to pathologize stress as totally bad. But in fact, if you can see, I don't know if I have a pointer, in this yellow area, you probably can't read that, it says optimum stress. We actually perform our best in this area of optimal stress. So we don't want a life that is stress-free. A lot of people say, I want to remove all the stress from my life. And in fact, you want to push yourself a little bit to try new things or to be in scenarios that cause you to perform or focus better. If you are having too little stress or care too little, then you're going to have this inactive area or too little stress or underload. And then maybe you're too laid back to the fact that you're not doing the things or able to mobilize for the things that you care about. In the optimum stress area, you can focus better, you tend to perform better, whether in your relationships or in your job or in the things that you care about. And then we very quickly, at the top of that curve, can flip into too much stress or overload. And that may be because you're under financial stress, the stress of all the questions that you have for your doctors, not getting answers, going to lots and lots of doctors. Those things can very quickly push you into this area of fatigue and exhaustion, and then tip us into burnout, anxiety, panic, and anger, or the breakdown in your emotional coping or in relationships. And this is just a different way of looking at this curve, but as you can see, performance improves with a good amount of stress, and then we can tip into that distress area, and then there is very little performance because some people are paralyzed by that amount of anxiety and stress. And I see some heads nodding because I'd imagine you've felt this way maybe at the beginning of your diagnosis or as new symptoms come about, or this may have actually nothing to do with your health. It may be stress in other areas of your life with relationships or your job. So it's really important to recognize and to start to familiarize yourself with how you know when you're moving from that optimal space of stress and performance to exhaustion and difficulty focusing. So that's why I wanted to kind of break down different ways of responding to stress. As I mentioned already in our quality of life, a number of these areas, but there are other areas in terms of how we respond to stress. These are negative responses to stress highlighted here, and we will talk about more adaptive coping. But if you end up with these negative responses to stress, or if you end up in that very high or overload area of stress for a chronic amount of time, you end up with anxiety, depression, sometimes checking out of life because you don't feel capable of managing it. So as I mentioned just a moment ago, it's really important for you to start to familiarize your own self with how you respond to stress. Some people tend to have social responses to stress, and none of these are mutually exclusive. You could be having all of them at once, and that would be, excuse my friends, a shit show. But some people do when you get to that place. The social responses to stress are some of the ones that our family members and loved ones will notice. You may withdraw. You may actually reach out and say, I just can't do it anymore and need help from others. Or you may deny help. People are offering, they're seeing that you're struggling and you're saying, no, I got it, because you're so afraid to ask for help. You may fight or get aggressive or irritable with loved ones, that they're often the ones that get the brunt of our stress, even if it's coming from lots of other places. Our loved ones tend to be the ones that get the brunt of that. The biochemical response to stress this refers to that flight or fight response that is natural and innate within us, is increased metabolic rate, altered hormone levels, adrenaline, cortisol, ACTH, altered endorphin levels. And there are a number of studies that show us that those elevated levels of cortisol and adrenaline can result in impacts on our immune system, result in us getting sick, gaining weight. So we know that chronic high levels of stress can result in a number of other medical conditions and can possibly inflame, what the experience that you're having. The physiological response to stress is higher blood pressure, rapid shallow breathing, increased heart rate, dilation of pupils, muscle tension, dry mouth. These were all really adaptive to our species in surviving when there were true threats to our body, as in animals chasing us down. We no longer often have that situation. I don't know, in Colorado maybe more frequently than other places. But this is the fight or flight response that all animals they're the only way that we as species have continued on. They have protected us. The problem is, this is a response to perceived stress, a perceived threat. So if you perceive the guy that cut you off driving as a threat to your well-being, you will hop into this place. That is not helpful to your body. But this is essential to learning how to cope with stress. I love that there's like pointing going on. That happens all the time in our car. So it's really important to recognize when you start to feel that dilation of your pupils or that short and shallow breath or increased heart rate and say, is this a true threat to my humanness, to my psyche, to my livelihood? Because this is the trigger that you know that you're tipping into that area of overload stress. And in my practice, I see all the time that people perceive things as threatening to them that are absolutely not threatening, but it's more about our perception, our worldview, and the way that we feel that either our ego is being threatened or somehow our stability or our finances or our relationships are being threatened, and they respond with this. There are behavioral responses to stress. The most common in many people is change in their sleep. They either sleep more because they can't handle it, or they can't sleep at all because the moment the world gets quiet, they hear that voice in their mind that's telling them all the things they didn't get done today or all the things they don't know about. And then you open up your phone and you're Dr. Googling all night long, and you've created all sorts of extra stressful things. There's the use of alcohol and drugs, which is a way of also sort of denying and checking out of life. In fact, I'd rather say abuse of those substances. Absenteeism, again, this I mentioned is sort of checking out of life, not really being able to be present because you're so overwhelmed and in your head. And then aggression is fighting with others. Emotional responses to stress, depression, anxiety, irritability, crying, thoughts about suicide or ending your life, loss of humor, apathy, loss of the ability to feel joy. Again, these are after chronic, increased stress for a long amount of time. And cognitive effects of stress, lack of concentration, negative thoughts, worrying, and poor memory. I certainly see this in my own self when I'm stressed with too many things on my plate and I walk into a room and say, damn it, why am I here? I know I came in here for a reason, but it's typically when we've just sort of tipped it too far and we're not managing our stress well. So hopefully, as I've said this, a few of you have sort of identified these kind of sound like some of my, negative responses to stress. Again, these are negative responses to stress. A lot of people cope very adaptively with stress. And then there is the stress and pain circuit that we know that if you're under a lot of pain, which is absolutely stressful, it can result in feelings of anxiety, that worry about when is it going to go away? When am I going to feel better again? And then the anxiety can cause sleep problems because you're worrying about, is the pain related to this condition, that condition? Is it a side effect of this medication, that medication? Did I eat something bad? What is the pain? Which will result in the sleep problems, which will then result in our inability to cope effectively because we're sleep deprived. Then sleep deprivation and the not coping results in increased pain potentially. So this is not how everyone's circuit goes, but we know that when we are in pain, we are under stress. Pain is stress on the body, and how that looks is different for everybody, but it can certainly result in more stress in other areas if the pain is not managed well. So approaches to coping, as I talked about, there are good and adaptive approaches to coping, and there are passive coping strategies. I'll start with the passive because that's sort of what we've been talking about with the negative responses to stress. Denying that the problem exists. That can't possibly be true. I'm not going to deal with it. I'm not going to go to the doctor. I will handle it myself. Withdraw from social life, just feeling like you can't talk with people about what's going on with you, or the inability to engage with people. Avoiding the problem with drugs and alcohol, and when I say drugs, we're certainly seeing an increase in the misuse of prescription medications and people coping with life, not necessarily just with pain, but they're trying to sleep better, they're trying to handle life better with prescription medications, misused. And then blame and criticizing yourself. I should be able to handle this. I should be able to push through this. I can do this. I don't need help. What's wrong with me that I'm not doing this well? And that's a vicious cycle of anxiety. When we are feeling anxious or worried, we avoid the situation that is causing anxiety and worry. Many of us we avoid pain. It's a natural human response. But if we avoid and escape that pain, we have short-term relief, but ultimately it will result in longer-term problems that then will increase anxiety because it feels a bigger problem to handle. So I talk with my clients all the time in my office about, they're trying to avoid this. They don't want to change that behavior because that seems too difficult. I don't want to have this difficult conversation at work. And I say, well, then you're going to have it in 6 months. And it may be a more difficult conversation because you didn't have it 6 months ago when it seemed like less of an issue. So we very often, all of us, tend to avoid things that are painful or difficult. But they can certainly add to that increased anxiety cycle. The good news is there is adaptive coping. Now we will switch to the good news. Accept that the problem exists. This is a difficult one, especially when talking about a chronic illness. Accepting that it's part of my life and part of my identity, I think, is really, really challenging. And how do I want to incorporate that? What is the narrative that I'm going to have around this illness? Take action to get rid of the problem. So rather than avoiding it, addressing it head on, finding out who your resources are. You all are actively and adaptively coping by being here today. You're doing something to take on the condition, learn more about it, connect with people who have it, looking for advice or information. Again, you're also doing that. Adopt a new perspective, trying to make the most out of a bad situation. I don't by any means prescribe a Pollyanna approach, like everything's great, no worries, I'll find the good and the bad. I don't mean that. I mean trying to find ways of feeling empowered by your new challenge. None of us go through life without challenges or without trauma. So finding a way of changing how you approach trauma, seeing the resilience that you have in your family and yourself. Become aware of your feelings and express how you feel with others. We're not very good, again, about this in our culture. But I think there are great strengths in being able to say, this really makes me feel frustrated that I can't get any answers. I'm not asking for you to fix it. I just want you to know I'm not frustrated with you. I'm frustrated with the fact that I can't get answers. And being able to talk about emotions of sadness or loss or emotions of joy, feeling like finally I have a diagnosis. That's a relief. I'm not happy about the diagnosis, but I have a diagnosis, feels like I can do something about it. In order to move into that acceptance space and that self-actualization space, a lot of other boxes need to be checked. Are any of you familiar with Maslow's hierarchy of needs? Oh, good. Awesome. So what this theory of personal and human growth and development is regarding where we can focus our attention and how we are motivated to move through levels of self-actualization. I've worked in a number of places throughout my career where psychotherapy is not appropriate when people actually cannot get food on the table. They can't talk about how to cope differently or how to change the way that they manage stress if they are hungry or sleep deprived. So some of our basic physiologic needs have to be met, or at least we confidently know that they're going to be met in order to move from the physiologic needs into the safety and security arena, which is health, employment, property, family, and social stability. So if you have these first needs met, then you can focus on the next. If these needs are not causing you tremendous stress, then you can focus on love and belonging and with your family and friends and intimacy and sense of connection. Once that's met, then you're able to focus on growth in self-esteem, achievement, confidence, respect with others, and then ultimately that area of self-actualization. And not many of us are in this space all the time. We can fluctuate between them, but really being in that sort of Zen space of everything is okay, and now I'm going to focus on growing me, my morality, creativity, spontaneity, acceptance, and meaning and inner potential. These things are not mutually exclusive, but just to know if you're feeling stress in a particular area down in these lower realms, it will be hard to focus in this upper realm of self-actualization. So to talk about coping, I wanted to talk, so if you think back, I should have popped in that little puzzle piece slide. So I'm going to break down some coping strategies on the different domains of our quality of life. So these are some regarding social. Relationships matter, and they matter profoundly in our life. We are inherently social beings. Even I, as an introvert, am a social being. This is not my actual comfort zone right up here, but I enjoy teaching. So in terms of how to grow and handle your romantic or partner or marital relationships while facing a chronic illness, it can often be a time of walking on eggshells between partners and even close and dear family. I've seen this throughout my career when working with couples, is that the one who is the identified patient says, I don't want to talk about this all the time. The one who's the spouse or the caregiver is like, if I don't ask enough, does it sound like I don't care? And so you're both wondering, when should we talk about it? What, should I ask? You look like you're in pain. Do you want me to help or no? And so it's this really delicate dance, whether that be a adult parent and child caregiver situation or partnership situation. I can't tell you how many times I get the individuals separated and they say, I don't know when to ask. I don't know what to say, either the patient or the identified caregiver. So the key is open and honest communication, absolutely key. But how do you go about that is really up to you as a partnership. And it's really important to create a time and space where that feels safe between the two of you, because you may be feeling, the identified patient may be feeling really well one day, and the identified caregiver says, I just found something online. I want to tell you about this. We need to make an appointment with this doctor. And you're saying, the patient, God damn it, I didn't want to think about my illness today. I was actually not a diagnosis today. I was my other self. And so it's really important that you find a time that that you can connect, whether that be, we're every Sunday morning, we're going to just have our healthcare download, or if it's on a daily need. Of course, when you're going through an acute situation, that's different. But when you're in your chronic phase, trying to figure out when as a couple or when as a family you're going to talk about this. I had a couple years and years ago who were dealing with a chronic illness, and they were fighting over this all the time. And they got a little stuffed gorilla, and that was the token or the reminder to each other. They would pull it out and put it on the microwave in their home. And I have something to talk with you about. And that's when they would say, okay, when I'm ready to talk, I'll talk about it. And it was sort of within a 24-hour period. I'm going to put that gorilla out there, the elephant or the gorilla in the room, they like to joke about, and then we'll talk. But if that stayed away, we don't have to talk about my health situation. So I think if a family can find something like that they can communicate to one another, like, I've got something, but I don't know if this is the time. relationships that function well don't just happen. They require work and they require attention. So don't make assumptions no matter how long you've been together. Once this new diagnosis or this health situation comes into your life, it's like another person in your dyad. Now there's sort of this triad and maybe the healthcare people in your life. And so figuring out how to attend to that, how are you guys going to navigate around that? Social role changes happen and also require communication. What that means is you may be struck with a diagnosis that requires that you're no longer able to do some of the work that you did around the house, maybe cooking, maybe cleaning, maybe the laundry. And then you have to talk about, you may not do it like I did it, partner, but I accept that you are going to, and I'm grateful that you're able to. And so you have to give a little bit in that area. But there may be days when you'd really like to cook a meal again, but maybe your partner has decided that they have become, the next Bobby Flay. And so you have to sort of say, hey, I'd like to take a spin at cooking on the weekend, see how I'm feeling, and let's work on this together. So again, it's really about communication and putting that stuff out there and not making assumptions about what you want, what they want, really trying to figure out how you can partner and recognize that there's sort of an elephant in the room, this new thing that's requiring shifts in your relationship. Again, openly discuss expectations. And then there are problems caused by pretending to be cheerful and denying some of the more difficult emotions. So I think, as I've mentioned, it's really important that you're able to express all the emotions that you're feeling. And in this culture, we really tend to endorse this, like, I can do it, I can push through it, and it's okay to say that I'm not okay today. And intimacy is an essential part of quality of life, of satisfying quality of life. So you may feel really tired. You may feel unable to engage in the same type of intimacy activities that you have done in the past. That doesn't mean that you need to lose that as part of your life. And it's really important. It definitely goes discussed in doctors' offices about how has this illness or how have these symptoms affected your ability to find sexual satisfaction. So it's really important that you talk about this as a couple, that you talk with your providers about, are there any things that can be helped to supplement? I had a patient years and years ago that was paralyzed, and he and his partner talked openly about how difficult that was, and they found a tremendous amount of gratifying intimacy through touching each other's faces. And so I just want to say, be creative, and it doesn't have to go away when your body and your physical life change. Other relationships that matter are work and employer relationships. It's really important that you know your rights as an employee. It depends on what size of company that you work for. Your rights will be dependent on that. But I think people often don't want to ask, don't want to find out, and there are ways of finding out about your rights as an employee. Did I skip? Oh, I'm sorry. I skipped forward. There we go. I'll skip back to friends. I know you're hotly interested in that. Also consider creative ways of remote or part-time employment. I found this website as I was doing this research, best work-at-home jobs for people with chronic illness. There is a tremendous amount of remote work that's going on right now, so that's a benefit. There are human resources departments that can be helpful, and there are also employee assistance programs that offer a lot of different resources. Some people don't even know to ask. So depending on the size of employer that you may have access to these benefits. Consider the narrative and the way that you want to be viewed at work. So you may be dealing with a fluctuating illness, of course, and symptoms and side effects that you can't control, but you may or may not want everyone at work to know about that. So figure out how you want to be identified, and that may change. So it's just important that you recognize that you have control over the messaging around how you want to be identified at work. Structure and planned activities can result in improved mood and increased sense of wellness. I put that in because I've worked with a lot of people who felt that they weren't able to work. due to their illness, and then had very little structure to their day and very quickly became depressed because they didn't feel like they had anything that was fulfilling or meaningful. So whether it's an employment for pay, or it's a volunteer activity, or it's other things that help you in your health and wellness, if your illness becomes your full-time job, which I know that it can, have some structure to it, have some plans around it, because it will help you manage your mood and potentially help you see patterns in your symptom picture. But if you're spending most of the day in bed or in front of the television without doing things that feel meaningful to you, it's a recipe for feeling anxious or depressed. Try and take a sip of water. And change the slide. Where's my third hand? So relationships that also matter are your friends and your community, and you guys have developed, it sounds like, a really meaningful community through this organization. So that is a real strength in finding organizations that can support you and people that can understand what you're going through. Your family and your friends may not understand in the same way, and those relationships can evolve, just like all of the relationships in our life. As we go through life, we become really close with our neighbors because that's easy, and we may have less interaction with people from our childhood. So it's not bad if relationships evolve. It's actually just part of life. And as a result of this diagnosis in your life, your other relationships may evolve because people may not know what to say. They may say stupid things, and there is such a thing as saying stupid things. People like to say, oh, you can't say anything wrong. Just be kind. Just be sympathetic. No. People like to offer you all sorts of steak oils and all sorts of other things when they find out you have a condition. So I think it's important to protect yourself against those people. Not to say that they can't be your friends, but it's important for you to put those boundaries to say, I really appreciate your concern. I'm handling, the managements of my symptoms with my doctors or whoever. I'm not interested in what you have to sell, but hey, let's still go and, play cards or whatever you do. Stay close to those who support and inspire you. It's really easy to feel overwhelmed and feel like you have a difficult story to tell, and so you just don't want to be around people. But it's really important that you stay connected with people, because the longer you're away from them, the harder it is to connect. Be clear in asking for what you need and what you want. Again, establishing these boundaries from the people or the family members or the loved ones who have all sorts of cures and things that they can offer that they found on the interwebs. And maintaining contacts has gotten somewhat easier these days with social media, but I will say that there are some detriments to social media. It can become an addiction. We actually have seen that people who spend more time on social media tend to be more depressed and anxious than the peers who spend less time. Some really good research has been coming out. So although it feels like we're connecting with people, we're only connecting with the part of themselves that they want to put out into the internet. And so it's not true connection. But I do see the use of social media, especially in connecting groups like this that are across the country, trying to find people that have a rare condition that can help relate to you, as a tremendous benefit that we did not used to have 10 years ago. It can be very, very powerful in connecting with, with clinical trials, with people who are your same age peer that are living across the world or across the country that can give you some ideas and tips. So I just wanted to note that it's important to get off of the screen when you can. We really spend way too much time in front of these screens, and you really need to get out of your house and get around real humans. There's so much different energy being connected with other people than the people that you meet on the social media apps. And diversify your portfolio of friends and acquaintances. So you're doing just that, but maybe you had to give up a hobby that you loved because of the symptoms of this illness. Find another hobby that you love that you can connect with people and get passionate about. The physical coping strategies, there are a number of them, and I saw the last slide of the last presenter included physical therapy, and I'm a huge proponent of physical and occupational therapy as a start to an exercise or an activity plan, because they can help you know sort of what your baseline is and where your areas of growth are. If you Google how to get fit with spondylitis, that may not give you the right tools for you as an individual. Your bodies are all very different. So if you can get a consultation with a physical or occupational therapist, it's a great tool. Breathing exercises. How many of you have participated or done any relaxation breathing exercises? Yes, awesome. So we're going to do one at the end. But there are 2 breathing exercises that are very easy to remember and easy to do. The one is the 4-7-8 breath, which is to inhale on a count of 4. It's not 4 seconds, it's just your count. Hold it for a count of 7 and exhale very, very slowly for a count of 8. There have been a number of very well done randomized control trial studies that have shown that it helps with cardiac disease and reducing heart rate. And then the square breath or the box breath is to inhale for 4, hold for 4, exhale for 4, hold for 4. So it creates a box. Also, it has a lot of evidence. I personally prefer the 4-7-8, but I know a lot of people who prefer the box breath. Do that for a few cycles every morning, every day, once a week. Anytime you do it is better than none. But deep breathing exercises are profoundly impactful on our sympathetic and parasympathetic nervous system. It brings us away from that fight or flight and can center us again. Making adaptive and ergonomic changes, whether at your home or in your work environment, are very important. These chairs are sort of the ergonomic design. If you don't know what that term is, it's really creating comfort in the things that you do repetitively. And then I'm a huge proponent of complementary therapies for connecting with our body in a nonverbal way, in a way that is private and creating an hour-long space for relaxation, whether it's massage or acupuncture or Reiki or healing touch. The evidence is really growing to the benefits of these complementary therapies. I don't call them alternative because they're a complement to a Western medicine. They are, in fact, really becoming evidence-supported in terms of managing stress, pain, nausea, hot flashes. A number of different things are treated with these complementary therapies. And then sleep hygiene practices are really important. And not a lot of people are familiar with the term sleep hygiene, but it's about having a routine around bedtime. A lot of people have televisions in their room. I will tell you, I may absolutely remove the television from your bedroom. The bed is for sleep and sex only. This is what any true sleep doctor will tell you. Even reading is supposed to not happen in bed because your body is supposed to be conditioned that when you get into that bed, it is for sleep or sex. So it starts to wind down as you get into that bed. Books can be very exciting. You can get anxious. You can become thrilled. You can cry with books. Same with the television, of course. So keeping those things away from your bed if at all possible. Sleep hygiene practices also include reducing kind of the stimuli that you're exposed to in preparation for bed. So if you can, shut off the television and not watch the news right before you go to bed, because that gets us all anxious and fired up. And that's not what you need to be feeling as you go to sleep. So think about ways that you go to sleep and think about ways that you can improve the likelihood that you're going to have restful sleep and not be spun up at night. We have more control of the time that we can, prepare to go to sleep. I would say give yourself 5 to 15 minutes in preparation. If you can take a hot bath or have cooling tea, that's even better. And then try to wake up around the same time every morning, if at all possible. Those are some sleep hygiene tricks and tips. Emotional health and wellness. So this is my wheelhouse here. This is what I do in my practice, is helping people to identify adaptive emotional coping skills. So one of the big ones is identifying and expressing emotion. A lot of people don't even have words for how they feel in their body. They're able to scream and yell at people, or they're able to cry, but they're not quite tuned in to what those feelings, how to identify or use words for those feelings. One of the greatest practices that I can instill as a tool for you today is a gratitude practice. And I've done a lot of research in this area about what an impact it can be in preventing illness and preventing mental illness, and helping to treat any feelings of depression or anxiety. So there are lots of ways to practice gratitude. You could keep a journal. You could put, gratitude little ideas in a jar as you have them. You can go on a gratitude walk. And what this really is about focusing on what's working, focusing on what makes you feel good in life. It's not Pollyanna. It's not feeling grateful for the things you're not truly grateful for. It's about focusing your attention on what works in your life. Being here today, I bet you feel grateful that you're able to do this and meet with people like yourself, feeling grateful for the people that love you and support you, maybe grateful for some of your docs, maybe not grateful for others, so you don't have to think about them when you're doing this. Writing a thank you letter or a count your blessings activity can be very powerful. We do this in my household every night at dinner. We talk about our high, low, high, which is the highlight we have of our day, talk about what the low point was of our day, and then end on what the high point is. So really focusing on, what works in life, because we can easily get into this cycle of complaining and being angry and feeling down. And if we focus only on those things, then we miss the parts that are really working. Artistic and creative expressions of emotion can be very powerful when you're feeling frustrated and down, or just needing to create something out of the mess that your life might feel like. Talking with a therapist, of course, I'm biased about that, but there is something we know, evidence supported, in terms of that, having that protected space to talk with an unbiased individual. So this is very different than talking with a friend or a family member. It may be a clergy or it may be a licensed therapist, but having that 50 minutes that you can go and vent and no one's going to judge you and no one's going to ask you a week from now, at your desk, oh, you were really pissed last week. Are you still really pissed? This is really about, a relationship between you and your therapist. And then mindfulness practices, and we will do a deep breathing mindful practice at the end of this. I actually mentioned here some of the apps that I really like for mindfulness. How many of you do any sort of mindfulness meditation practice? Great. I would love to see more hands if I were to do this talk next year, because it's low-hanging fruit in terms of wellness and health prevention. Some of the apps I like are Headspace, Buddhify, Calm, and Insight Timer. Some of them are a nominal fee and some of them are free. Headspace sort of takes you on a course. It's like a mindfulness course, and the others you can just open up at any point in time. What I really like about Buddhify and Insight Timer is you can look, and some of the guided imagery activities are as short as 3 minutes and others are as much as 15. And so if you're like sitting and waiting for a doctor and it's going to take a little bit, you can pop in a meditation and really center yourself. And so we'll get back to doing this. We'll do the meditation. And then so I think I mentioned earlier, but if chronic stress can result in diagnosable anxiety and depression, especially if you were low-lying anxious or sort of underlying dysphoric in your life, and then you have a diagnosis that takes away parts of your life that you really value, that can tip you into a space of feeling kind of hopeless or feeling really worried all the time. And so it's important to know that if painful emotions last for longer than 2 weeks, can't shake it, or if they're taking away your ability to feel joy or your ability to do the things that you like to do, you just feel like you have to check out, then it really is time to see someone, because we don't want you to get into a place where you're so down that you feel like you have to give up and that's the only option that you have. So do know that from a diagnostic perspective, it's about 2 weeks of a symptom before someone like myself would say it's a diagnosable disorder. Most of the people I see have what I say is an adjustment disorder, which is you're having a really normal reaction to an abnormal life circumstance. Of course you're going to feel down. Of course you're going to feel angry. This is a detour you were not expecting in life. But that doesn't mean that's how it has to feel all the time. There are ways of adjusting and adapting to that. Treatment options for these painful emotions may include psychotherapy, relaxation or stress management skills. There's something called mindfulness-based stress, MBSR. Mindfulness-based stress response is a great, you can do it in a 6-class course. Really great skill to have. Communication skills building, complementary therapies, medication, exercise, and nutrition. So you may have heard from a doctor that, oh, you're feeling sad, here's a pill for that. We know more and more that that is not the best tool for sadness and anxiety. It can be a complement to therapy or learning some of these other skills, but we have more and more evidence that the pills are not the long-term response to anxiety and depression. And here are a few of my go-tos of resources. If you've ever heard of Full Catastrophe Living or Jon Kabat-Zinn, he's one of the grandfathers of mindfulness practice and meditation. It's a great book about how to just face life's unfortunate circumstances, face them down, and create resilience out of them. We Are Not Alone is a book about learning to live with chronic illness. It's a lot dated, but I still think it has some good tools. Guided imagery and by symptom and condition. This is a great website, Health Journeys. The woman's name is Bella Ruth Naparstak, and she has a whole library of downloads for sleep, quitting smoking, losing weight, chronic illness. So they're guided imageries based on your symptom situation. And then there are a lot of bloggers out there, and I have mixed feelings about that, but there are just lots of resources out there. And what I like about the bloggers is they tend to be able to put into words some of the things that we have had up in our head and are having a hard time expressing, or give us tools and ideas of other things to research. There just happened to be a sort of a download of all these different chronic illness bloggers. Oops. Elin, how are we on time? Okay. Oh, wow. I spoke quickly. No, 1:38? Okay. So I'm going to do a 5-minute deep breathing activity. Get comfortable in your seat, uncross your legs. You may or may not choose to close your eyes. I won't stare at you. I'm going to sit over here and do it too, because I just like how it feels. As I said, it's just a 5-minute deep breathing exercise. So we're going to listen to somebody else's voice, not mine. And just think about, while you're doing this, barriers that you may have to this, because this is certainly not the only one. And just notice the thoughts that pop in and out of your head without going for a ride on them, because we have a constant monologue going on in our head that we don't notice all the time. And when we try to slow our heads down, we will hear it. It's not about chasing that down. It's just about noticing without judgment.
Mindful breathing. Close your eyes and rest your hands on your knees. Bring your awareness to the touch of your body on your seat. Feel the weight of your body on your chair or cushion. Begin by finding a comfortable posture. Lean slightly forward and back to one side and then the other. Find a comfortable balance as you come back to the center. Now, sitting up straight, feel your head on the top of your neck. How can you sit so that your head, neck, and back feel most comfortable? Take a few deep breaths. While you are breathing deeply, relax your shoulders, your stomach muscles, the muscles in your face and your hands and your legs. Let go of all the tension in your body. Now bring your attention back to your breath. Where do you feel it most? In your nose or your stomach? In the rise and fall of your chest? Just notice where you feel it most and allow your breathing to be natural and relaxed. Now, notice what the breath feels like as it enters through your nose, goes down your throat, filling your lungs, and back out through your nose. Notice your stomach and chest rise and fall with each inhale and exhale, and allow your breathing to be natural and relaxed. Now bring your awareness to the sensation of your breath in your nose. Feel your breath as it comes in and goes out. Just focus on this sensation, paying attention to each inhale and exhale. When your mind wanders or if you become distracted, just notice what's going on in your head, and then gently bring your attention back to your breath, going in and out. Focus on the sensation of your breath in the foreground, allowing thoughts and feelings to come and go in the background. Now gently bring your attention back to the touch of your body on your seat and open your eyes.
Isn't it amazing how long 5 minutes feels when you're just quiet? We're all winning now because we did 5 minutes of deep breathing. It's also incredible how loud our voices in our heads get, isn't it?
Mindful breathing.
Oops. Let's do it again. Oh no. I really like it so much that we're going to do it again. Just kidding. Okay. Any other questions? I saw a few hands. Yes, sir. Okay. Okay. I can hear. Okay. Yes, phenomenal. If you're going to a trained hypnotherapist. Good. Oh, good. Well, there you go. Give everyone your card. Oh, absolutely. I see tremendous benefit to it. I'm a little bit wary in people who have a significant trauma history. It can be a little bit destabilizing. But self-hypnosis is wonderful. And I think, is the next level of what we're doing here, or what I'm talking about in terms of meditation and mindfulness. I am a big fan, and I know that there is good evidence. I think the evidence is great in the studies that have been shown, but finding a practitioner that is really good, that does a deep assessment of the needs of the patient, is really important first and foremost. So I tend to be very particular about who I would refer to. Mm-hmm. Awesome. Oh, that's phenomenal. I don't know if you heard him say that he took it for himself, hypnotherapy, and then just for your own well-being, and then became certified in it because you found such a awakening of your being. Absolutely. And when I refer to stress management, that's certainly one of those things in that realm of those activities. Any other questions? Yeah, it's such a good question. When you're in a helping position, people seek you for help, and I find that to be the case when people eventually, finally call to make an appointment. It's been months and months of thinking about it. Same with going to a support group. So it can be a very cathartic experience, a lot of tears, a lot of emotions because they finally did this thing that they were afraid to do. Oh yeah, oh, all those things. Oh, right. Yeah, absolutely. Yes. And I think just naming that for them, just to sort of normalize and say, I bet it's taken you a long time to actually get here today. And to say, most of us at our first meeting felt very similar to how you feel. That's not to dismiss what you're feeling, but to say, we can't handle it all in this meeting, but we are so glad you're here. And we're going to give you some tools to move forward. And hopefully you have a resource list of, people that you would refer to as a group leader. If you don't, I would say at a minimum, that is something you may want to do is find a couple of partners in your area and in the mental health arena who you feel like are good resources. Any other questions? Oh,
Is this better? Great. Thank you so much. We have a lot of our support group leaders here, as you may have seen. So I want to ask, what do you kind of suggest or speak to preventing burnout in these wonderful people who are supporting others and yet themselves dealing with their own chronic illness?
Yeah, it's a great question. Well, as a support group leader, I hope you were really identifying with that burnout curve because if you're feeling that sense of sort of checking out or tuning out or feeling hopeless, you really have tipped into that burnout arena. Things I would recommend is just sort of figuring out for you when you start to get stressed, and are there tools that you can use within the organization to help yourself manage. Maybe you need to have other speakers come in. I don't know how these groups are formulated, but when I've done support groups in the past, it was really nice to have sort of every other group be more psychoeducation focused so that we had a topic we were learning or a skill that we were learning, so it didn't feel so chaotic each group. So every other was a little bit more open-ended, a little bit more emotive. But I think being able to have sort of a skill or a topic that you're planning to talk about can help contain it a little bit. As a support group leader, it does probably feel like you're doing a lot of counseling. So if you are able to, access some sort of training in that or learning a little bit about support group dynamics. I know I mentioned to one of your group members here, Irving Yalom is the grandfather of support groups, and I would suggest doing some of his reading. And his is really about sort of process groups that evolve together. And I don't know if that's how your groups are designed or if you have some people that have been there for 5 years and one person that shows up once. And that's a little bit difficult to manage versus a group that is cohesive and stays together and grows and evolves together. So if it's the former, that group where it's unpredictable, one person that's there for years and years and one person that shows up once and blows up the room and then never comes back, that's where a sort of a psychoeducation or a little bit more structure around the group can really help the facilitator feel a little bit more control of that space. Yes. Oh, thank you. Yes. Yes, Elin has it in PDF, and you can have it. And my card is on the back table. You're welcome to email or call me if you have any other particular questions. Yes. Oh, some say luck, some say not so much. Oh, awesome. Yes. Yep. Yep. Mm-hmm. Or an art therapist, I would say, or journaling. I mean, there are lots of cool skills, activities that don't require a degree to be able to do as a group, or at least find some ideas. That's what I was talking about in terms of the creativity and self-expression. It's really about creating your own narrative about what does this chapter of your life mean. Your spondylitis, your illness is not the book. It is not your only identity. It is merely a chapter. It may find its way into future chapters, but it is not the whole story. So it's really about creating your narrative. I think we have. Okay. Okay, thank you. Go ahead.
Thanks. I just wondered, this may be a little off topic, but you have any thoughts or comments on the impact of gut health, the microbiome on psychology and our mental health?
You know, I'm curious about the literature that's coming out. I can't say I'm an expert in the arena, but I think we cannot dismiss what we put in our body is essential to our total well-being. So when I assess all of my new clients, I'm not only asking about substance abuse and drug use, but I'm asking them, how do you feel like you eat? How is your diet? Because absolutely it can contribute. But I wish I knew more.
Yeah, okay, thank you.
This was a very popular topic, and I'm sorry if you had questions we weren't able to get to them, but I do want to thank Dr. Lomax. Let's give her a round of applause. That was great. Lots of great information. And we would like to present you, make sure I don't have it upside down here, present you with this plaque here, and we want to get a picture.
Oh, great. Thank you.
All right, I'm going to turn it back over to Jason or Aline to close things up.
All right. We know we've had an action-packed day filled with lots of information, but hopefully you are leaving feeling energized, encouraged, and that you'll be able to take back with you lots of good info. It's interesting, a quote that I think is very fitting for how we should end the day. Writer-poet Christine Mason Miller once said that at any given moment, we have the power to change how a story ends. And with all of you here being here today, we want you to feel empowered and encouraged to be able to change the narrative around what it means to live with spondylitis. A few more closing announcements. We will have a short break, but we'll pick up again at 3 o'clock for the next segment, and that will be for the SGO conference officially kicking off. All right, thank you so much for coming. I'd also like to, no, that is actually moving into conference room A. Okay, and I'd also like to thank the sponsors for today's event. Our platinum sponsors, Abby and Novartis. Gold sponsors, UCB. Silver sponsors, Pfizer and Amgen, as well as bronze sponsors, Behringer, Lilly, and Janssen. Thank you so much.